Yeah, hello and welcome to Wimpole Street Dental Clinic. My name is Christian Mill, and in the following small presentation we would like to show you one of our cases of the month here made in our clinic. So thank you very much for watching and we hope you enjoy the video. Yeah, hello and welcome to Case of the Month in February 2018. Sorry for being a little bit late. As always, thanks very much to Catherine, who provided brilliant dental technician work again. And yeah, before we go to the case, I would just like to discuss with you a few golden rules in the aesthetic dentistry. Of course, these golden rules have always to be applied with caution and need always to be verified with the patient in order to deliver a successful aesthetic result. But they're guidelines and they help you to get there. So when we have a look at a smile, there are three aspects which come to mind immediately. There are static aspects like the teeth and the soft tissue like the gums. Then you have the moving tissue around like lips, cheeks, and the facial muscles. So as dentists, we basically can only change the static aspect of a smile, which is the teeth and the gums. So when we have a look at the teeth, the most important rule is that the first two front teeth, tooth 1-1 and 2-1, that they're absolutely symmetrical. Whenever you have to compromise, try to put the compromise as far back as possible. Whenever you achieve that, you get an aesthetic result. Of course, there's still other rules like the length to width ratio, which should be around 75%, so something between 70 and 80%. Then, of course, the golden cut between the teeth, which are visible from the first front tooth to the side, to the lateral incisor, and then the canines, and then the premolars. Then, of course, the angle of the teeth, that the angle mesial of the teeth is sharper than the angle distal, the shape of the tooth, and the position, the angle of the tooth. And with regards to the soft tissue, to the gums, of course, we have the connective line between 1-1 and the canine, or between the central incisor and the canine. The lateral incisor needs always to be below that line with regards to the gum line. On the other hand, when you have a look at the incisor line between the central incisor and the canine, the lateral incisor again needs to be below that line. Whenever you don't do that, you'll have an anesthetic smile. So let's go and apply these things in a second with the case. Of course, when you have a smile, you just have to have a look where's the highest point of the smile from the angle of the mouth. And do you have a buccal corridor? We in Europe normally produce a darker area between the molar and the cheek, the inside of the cheek. The Americans tend to try to fill that with crowns or with crown spacing so that you don't have a buccal corridor. And one very important rule is that the incisal edges of all teeth should follow the lower lip line. If they do that, you get an aesthetic smile. And as a reference, the canines should touch, when you smile, should touch very lightly the lower lip. If they do that, you'll have an aesthetic smile. And then, of course, one aspect before restoring is very important. That's whether you just see the incisal edges, where you see the first signs of the gums, or whether you have a gummy smile. If the gummy smile is always very difficult to restore, you have to really get it perfect. And if there's any chance to reduce the gummy smile by elective surgery, it is an option worth pursuing. And then one aspect we sometimes forget is to have a look not just from the frontal side, but from the lateral side as well. That means it's called the diamond light effect. That means if the light from the sun is reflected from the teeth into the eye of the person who looks at the teeth of the other person, is very important that the teeth are between 90 and 110 degrees. If they go a little bit to a retruding position, the light will be reflected to the ground and the smile is not seen as aesthetic anymore. So have the teeth a little bit protruded to make sure that we get the diamond light effect and that you have structure in the tooth so that the light is splitted into different light rays to make contact with the eye of the beholder. And one thing before we chastise ourselves is that we only will achieve the perfect result if three things come together. That's a facial harmony, that's a dental harmony, and the gingival harmony. If one of these things is not perfect, you can forget your aesthetic result. You can do the other two things as perfect as possible. You will have no chance in achieving perfection. But of course, you can get close enough with doing just two, but only real perfection you'll only have when all three aspects are perfect. So let's use our knowledge now in this case. That is a case of the month in February 2018. You can see in this case nothing fits. This lady had a bridge fitted in the left anterior region, and she was obviously very unhappy because the dentist did not apply the golden rules we just learned. Reason is, if you have a look, the two central incisors, they're not symmetrical at all. The gum line does not fit. The length to width ratio of the lateral incisors is not good. And of course the color is different colors of the teeth. That's not working at all. So what we did is very simple. We did, of course, cleaning. We did the conservative treatment, fill all the decays we had, do the root canal treatments where we had to get a clean and nice mouth, and then we could focus on the aesthetics. And that means in this case we cannot have a perfect result without orthodontics. That means we need to extrude the left central incisor. And that's what we did. Proper cleaning, proper conservative treatment, and then extrude the tooth. Did a small gingival graft on the lateral incisor on the left side, and then we're ready for the prosthodontics. You can see in this case the gum line, which gives the key, is good. You can see a small mistake from the already, which will continue to be seen in the work, that the gum line between the right central incisor and left central incisor is not quite symmetrical. We try to achieve that with cutting a little bit away, but to no avail. You'll see at the end of the work. What is beautiful in this case is the left lateral incisor, that the gum line looks like a tooth is coming out, but actually it's just a pontic. Taking the color before the preparation, prepare the teeth, and 2 weeks later place the teeth. So you can see what I just told you. It's a beautiful work, nice and clean work, but the two central incisors are still not perfectly symmetrical. We should have a little bit higher arch on the gum line on the tooth 2-1. So that's something we should have done better, but the rest I think looks good. Shape of the teeth is okay. Still, the lateral incisors could have been a little bit more symmetrical. The left lateral incisor could have had a little bit clearer margin. And that's then the final work. The teeth follow the lower lip line quite nicely. Both canines touch the lip. And here this is a picture with a so-called polarization filter. That means a filter which removes most of the reflection and allows us to have a look at the tooth shape a little bit better. And in my opinion, that looks quite nice. We obeyed the rule of aesthetic with the exception of the gum line of the tooth central incisors. Thank you very much for watching, and yeah, enjoy your dentistry.